Hello, everyone. If you can see me, please type. You can see me now, right? You can see me now. Please type a Y. Mr. Ifeanyi, thank you so much for being here. Thank you. Good afternoon, everyone. I'm so happy to have you here. Yes, thank you, Glorious, for being here. We're so super excited. My name is Dr. Juliet Ofia. I'm a medical doctor with over 13 years clinical medical practice experience. I'm an award-winning medical media personality. I'm here in Lagos, okay? And this is our first edition of Leading Women series, okay? Leading Women series is a platform that was put together by women that have had experience in leadership one way or the other. When I mean leadership, I mean in politics as well. We have a group called SWILI, okay, Strategy for Women in Leadership Initiative, where we come together, people that have run for several political positions came together to build themselves as leaders so that we can do, because what we've realized is that there's a lot that women can do, even without a political office. We can do a lot for ourselves as women all over the world. If you agree with me, please type a Y in the chat. So great things happen when women come together, great things. And we believe strongly in that. So this is a community where we are going to be coming together to help ourselves health-wise. Thank you for the acknowledgement, ma'am. We're going to be coming together to build ourselves in great health. I don't know about you, but in these times we've had so many people, lose their loved ones during this pandemic. Kamalara, if you are here, you can type your name in the chat and I'll know that you're here. Thank you very much. We have seen some people lose their loved ones during this pandemic. It has been really hard. Some people were hit hard financially and all of that. It's very tough. But of course, without health, we don't have anything. Okay, and I know some people have questions, reservations on how to manage information that they get online, how they manage information when it comes to COVID-19 vaccine, how they manage information on how to take care of them. So what is even working? So we are super excited that we have a specialist that will be talking to us today. She has a fantastic presentation she has put together for us. So, and I'm excited because we'll be able to share this presentation online. We're creating a community where you can also watch it or share it with someone else. The group is going to be called Leading Women Group, okay? So you can also find that on Facebook, and the recording of this presentation will be there. Okay, so we have our guest that is going to come up shortly. I've just made her host so that it's be easy for her to share her slides. She is somebody, let me bring my the coordinator on the screen as well. She's here. I've been looking for her. You can start your video and come on the screen. Welcome, Honorable Gonzalo Elemide Omolara. Are you there?
Good afternoon, sisters. Yeah, I'm with you. Good afternoon, sisters.
Okay,
so great to be
here. On the spotlight. All right. Let me see you. Is your video on? Oh, wow. Beautiful. Thank God for technology, right?
Yeah.
We are so,
Thank you very much, Mom.
We are so happy to see you. Thank you so much for this. So I'm just going to give you a moment to speak to our audience about what SWILI is about, and just like to introduce our guest. Thank you. Welcome. Go ahead, please.
Hi. I say welcome on board, my sisters.
Sorry. Can you hear me?
I can hear. Oh, I think the network
Yeah, because
at my end.
you can't see you. Your video is off. Your video is off.
Oh, my network here. The
Okay,
video is paused.
Your video is off. It's not on.
I think it's the network.
Okay, no problem. So I'll just introduce you who you are to the guests with your permission, if you don't mind, so that we can move on, because I wanted them to hear your voice at least. So
my network here is.
No, it's okay.
So sorry about this.
No problem. No problem. But we have acknowledged your presence, Honorable Elemide Omolara is somebody that is also very passionate about the topic. And yes, she's very passionate about the topic, and she contacted me and was like, we have to make sure we get this information out there, and we hopefully want to do this regularly. So I'm sure she's going to take the questions at the end, but I don't want to waste too much time. With your permission, Honorable, I'll move on to introduce our guests, if that's okay.
That's okay by me, ma'am.
All right, thank you so much, ma'am. So without further ado, I'd like to call on our distinguished guest. She is a lecturer, a senior lecturer at the University of Lagos. She has over 20 years plus experience in clinical medicine. She has gone around the world talking about this topic that we'll be talking about, the lessons that we've learned from the pandemic. When you're talking about people that have handled, the rigors of this pandemic firsthand, somebody that is in, a specialist, a public health specialist, somebody that has also gone ahead to write a book about this, okay? She has written a fabulous book called Coping in the Time of an Infectious Disease Pandemic. It's like a handbook, okay, for us to cope with any pandemic that would come our way. And when I read this book, I was so inspired. I'm like, people need to hear about this. She makes it so elementary, okay, for us to be able to, guide ourselves, especially as mothers, as, leaders in our society. We are in different positions in places of authority, even where we work. So it's very important that we equip ourselves with the information. And I asked her if she can come on board and educate us, and she agreed. So we are super, super excited to have her here. None other than Dr. Oluchi Kanma-Okafor. Welcome. You can unmute your mic, ma.
Hello, everyone. Hello.
Thank you.
Good evening.
Looking beautiful. Thank you so much for joining us.
Welcome. Wow. I'm glad to be here.
Awesome. Thank you so much.
You're welcome.
Thank you.
Thank you so much. So we are super excited to have you here to give us this topic, which is the lessons from from the pandemic, the things that we should take home with us. And we are so privileged that you, a public health specialist, with all your wealth of experience, first-hand knowledge, you've put together something to help us, but you are going to be giving us the presentation today. So if your slides are ready and you'd like to put it up, we'll be so, so excited. I'm sure you can do that from your end. Are you okay?
Yes, I can.
Awesome, awesome. Thank you so much. Please go ahead. The floor is yours.
Thank you very much, Dr. Jules. Always a pleasure. I'm going right in. So the topic for today is lessons from the COVID-19 pandemic. So I think the first thing would be to introduce myself. Dr. Jules has done a fantastic job of it, but I'll just do it again. Medical doctor, public health specialist. I'm a senior lecturer at the University of Lagos. I'm an author and a researcher, and most passionately, a health advocate. So this talk will be following this, we'll follow this outline. First of all, we'll do an overview of COVID-19. Then we'll talk about the impact, and then we'll take away the lessons. So this is the objective. We're going to learn about the basics. Then learn about how to, take life better, how to care for ourselves. Then those things that we shouldn't forget to do. Then how to, the importance of always being prepared, and then importance of good information. As a background, let's talk about the definitions of some of these, the things we keep on hearing: infection, infectious disease, and it's been going all around. But in this particular case, we're talking about a virus. But infections can come in the form of organisms, bacteria, viruses, parasites, fungi. And so some very basic infections around us, like malaria and things like that. And, maybe you have diarrhea or something. They're very much around us. They're all around us. So when they're caused by a microorganism, and this organism is a pathogen to at that particular point in time, it results in an infection. And an epidemic is also known as an outbreak. So sometimes we hear about an outbreak of cholera, an outbreak of measles. So that's what an epidemic is. And it is when a disease affects a group of people in an unusual way. So sometimes we have infections that are very common amongst us, like things like measles. Children have measles all the time. But if you get to a place where you have more than the usual amount, maybe several children within a particular community have the infection within a short period within each other, then we can call it an epidemic. But a pandemic means when an infectious disease of that nature or a health condition crosses a large geographical area. So we're talking about countries, continents, and then the number of people that are involved are a lot. So that's what we refer to as a pandemic. And it is a serious situation. It is serious in, as relates to the fact that it is usually catastrophic. It causes a lot of disruption of life and livelihood. So let's look at this pandemic. We're all aware we're right deep in the middle of a worldwide pandemic. It's been with us now a full year and still goes on. Even though the attitudes of different people, towards that pandemic may differ, but there's still no doubt that we're still immersed in it. So far, about 134 million people plus have been affected. They've, contracted it, and we have 2.9 million deaths out of this 134 million. So that's a significant number because we're talking about deaths in terms of human life. So it's significant. So pandemics, epidemics, they're not new to us. Human beings have always had that going on. If you remember in the past, stories of our parents telling us about how they used to get immunized in their forearm with a gun and things like that. That was when we had all sorts of pandemics in the past, and epidemics too. So the world has seen several serious pandemics, but I'll just highlight 4 here. Different for different reasons, for different infections we've had pandemics. The very recent one is the Ebola one. It wasn't as significant as this one because it was easily contained, and maybe because of the nature of its spread, it wasn't able to move that quickly because it's not airborne, or it's not it doesn't, the way the pathogen thrives in the body is it's different from how the Ebola was. So we didn't suffer that, the world didn't suffer that much. But this particular outbreak started in late 2019. First of all, we heard it as something happening in China. But before long, it was all over the world and it made its way to Nigeria. So what is COVID-19? It's a potentially serious inflammatory disease that affects the respiratory system and other parts of the body. So it manifests there, but it affects so many different parts of the body. So the virus is a part of a large family of viruses that is common in people. So the coronavirus is not new to man. It's something we've had over time. But this particular variant is what is different. And it spreads from person to person through coughing or sneezing, or when they come in contact with surfaces, after an infected person has left their germs there. So it can spread from individual to individual, from an individual who is positive with the virus. So if a person tests positive, okay, yeah, this person does have the virus, but sometimes the person hasn't tested positive, they have the virus and they can transmit it, whether or not they have symptoms. So it's just for the person to have the virus in them to be able to transmit it. So the symptoms, what do you see? It looks like every other illness. So, it looks like just, a person feeling unwell. That's what this illness looks like. Fever, cough, shortness of breath. Person doesn't really understand how they're feeling. And that's how you feel with even a common cold. But there are other symptoms too that don't even make it distinct. Have headaches, feel unwell, malaise, that's tiredness. And sometimes they have diarrhea, loss of sense of smell and taste. So the majority of individuals who catch this virus will not experience a serious form of the illness, and they will not need to be hospitalized. But if a person experiences symptoms that are similar to this, the best thing to do is just to step away from members of your household and contact the local authorities, because the nature of this disease means that the local authorities are very interested in it and will do everything they can to help the situation. So contact your local healthcare professionals because the numbers are available on the internet. Now, if the person lives in a place that has good enough, is appropriate for home care, that could be offered to the person. But if the person's illness is so severe and they probably need, for that disease to be proven and taken to the hospital, then they'll get a test. They'll get a test done. The authorities will come to their home, will get their samples, get their test done, and probably take them in for care. So testing is now readily available. So it's no longer an issue like it was earlier in the pandemic. We can get tested even from our cars. We have a few driving centers in Nigeria. Then we have the vaccine available now. So that's a picture of our president taking the vaccine. So the one big major problem with COVID-19 is the fact that it was fraught with a lot of myths and misconceptions and theories. So there's a big disconnect between the myth and the fact. And that is not unusual because it's a virus that we don't know enough about. It's maybe it's so new to people and we haven't had anything like this before. And it came in a time of a proliferation of social media when information is everywhere. And then it kept us at home. So people were looking for information. Some people were listening to COVID news, doing anything related to COVID the entire time. And so the facts and myths will not be affected. But the basics about COVID-19 prevention. COVID-19 is prevention. Prevention. If a person can afford to apply the measures that will aid prevention, then the person is good to go. So far, is there a treatment? None has been, there's none that has been stamped the treatment to use. Things help. Various many different things have been found to be helpful. And that research is still ongoing, but they're still being investigated. If you remember from the time it started, oh, this drug came up, that drug came up, and then in no time it will be refuted. Then people will argue about them, the different publications about them. Then somebody will say, oh, that was a fake publication and all that. So over time, so many different therapies have come out, but they are all under investigation. So right now, we have awaited a vaccination program, and we're still pretty much in the early stages. So we need a program that will cover everybody, give us a safe vaccine, free from theories and questions, that are accepted. So that work is still ongoing, even though the vaccination program has started, but the work of actually getting people to take it is still ongoing. Because like yesterday, I was talking to the woman who supplies me food stuff, and I was asking her, oh, have you had your vaccine? And she said, vaccine? What does that have to do with her? That COVID is for rich people. So you see where the misconceptions come. So before she can get to the point where she can take the vaccination, a lot of work. So we're still worlds apart from where we have to get when it comes to the control of this virus. People don't take it seriously, but if we remember diseases like the plague and smallpox and things like that, we have to eliminate them. Now we've eliminated polio because it was damaging the aesthetics of many children. So many children with bad, their legs all damaged because of polio. So we had to do something. Now, polio is a thing of the past. In the next couple of, going forward, we're not going to have children with damaged legs and, the deformities anymore because we've tackled polio. And so the same approach should be taken with COVID-19. People should be ready to, take that step to get the vaccine and things like that. So there's some simple ways, common sense protection. Those are the things we need to be able to thrive in this hand washing. So whether you're taking the vaccine or not, whether there's nobody around you that has it, hand washing. Hand washing is the simple, most effective health intervention in all of medicine. Hand washing, it saves lives. So if you can just approach that, that means you have to make, it's not just to make a commitment to yourself that you will wash your hands. But if you are in a position, provide what is required for people to be able to, use this singular health tool, which is hand washing. So if you're the mother of the house or the head of an organization, it's important to make it possible for people to wash their hands. Then things like a clean environment. That time is coming where we in Nigeria can no longer go the way we just carry on with our dirty environment. We have to change. We have to up our standard. Then face coverings, face masks, as uncomfortable as they are, as much as they cover up our beauty, we have to embrace them. As long as it is still in the list of the things that we need to do to protect ourselves. Social distancing, very important. Sheltering at home, isolation, when it's appropriate, when a person feels unwell, it's important to keep away. Even for any other infection, for example, if you have a child who has a rash and you're not sure what it is it chicken pox? Is it measles? What does this child have? It's wise and helpful to keep that child at home. So we're learning that now. We're learning the importance of isolation. So continuing with the basics about COVID-19, it's important to adhere to these recommendations, all like I listed before, all of them. The important thing to know here is that these recommendations are aimed at limiting exposure to COVID-19 or preventing worse outcomes. Yeah, so this is our new normal. This is us. This is what we look like now. We're just people with eyes, no more complete faces, but it's okay. We can color it up in different ways, like we've seen people doing here. If you embrace it, it becomes part of life. So let's talk about the impact of the pandemic. It affected so many people, just like Dr. Jules pointed out. So many people their lives were turned around. So many people, their lives got better. So many people, they were redefined individuals. So it had emotional impacts, and emotional impact. People were anxious, they were worried. It was fear everywhere. People were acting irrationally. I remember the person I know that was stocking up on drugs. She first bought a carton of the first drug as soon as it was mentioned. Then all these supplements that they mentioned that we should take, she bought a carton of each. Then they said we should take ginger, garlic, and so many turmeric, and what's the other one? Beetroot, and I mean all the vegetables, onions. She was ordering them in trailer loads. So that is an evidence of fear. That's an evidence of a person who is trying to do the best they can, but is basically working from a position of fear. Then uncertainty about the future. People didn't know what was going to happen to their jobs, to their schooling, to their businesses, their plans. Like my plans have completely changed. As of 2019, when it started, I could tell you the things that were going to be happening to me by May of 2020. They were going to be life-changing, but all that didn't happen. But we had to adapt. We had to do them in a different way. So the uncertainty about the future was one major thing. Frustration. They said, oh, this will be over in about a month. And then, so it's going to be over by summer. And no, it's going to be over by winter. Oh, when the weather gets warmer. Oh, we just could never really get to the end of it. And he's still here with us. Then continue with the emotional impact. People were lonely, people were bored. Families were breaking up because that was the first time they were confined together in one space without specific objectives. Then people had attacks, panic attacks. Those people who had some degree of mental unwellness started to show up. So there was depression, inability to enjoy activities. People were feeling guilty as far they couldn't meet up to obligations. Some families were separated and they felt bad some people felt bad because they hadn't made the decision to bring their children home on time or to go and be with their children. So there was guilt. And some people were confined with others that they wouldn't normally be confined with. So they wanted to be alone. They wanted to get away. Then some people experienced symptoms of PTSD, post-traumatic stress disorder, distressing memories, mares, people having flashbacks of times when things went really bad. Maybe they saw what they saw in a movie. Their minds were taking over. People were having changes in their thoughts and mood. People were getting jumpy. Then people were experiencing low energy levels when it comes to physical effects. Some people had too much time to sleep, or some people had so much time to sleep that they were not sleeping enough. Appetites were changing. People that wouldn't normally eat breakfast, lunch, and dinner were now eating breakfast, lunch, and dinner. People started getting bigger. Some other people, because they didn't have what they could eat, they were getting thinner. They were missing meals, so they started structuring their meals maybe once a day. So things changed. Then some people started having stomach aches, rashes, headaches, body aches, and pains from things just being unusual. Then even simple things like sweating. Some people started to think, oh, does it mean I have COVID? And people that had any sort of neurological illness or people that ordinarily had problems with their smell, oh, maybe I have COVID. So, it was all over the place. People were having all sorts of physical manifestations. Then those with health problems that had hospital appointments, they couldn't attend. So their health problems were worsening. I know a few people that lost their lives because they couldn't get medical help. So we have mental impact. Some people were no longer communicating well. Some people had to be followed up because people were no longer hearing from them. Then people were having memory issues, confusion, difficulty concentrating or making decisions. And there were fights within families. Whatever rivalry there was before started to show up. Alcoholism started to show itself up as well. Then, whether you like it or not, the drug networks had enough time to thrive. So people who hadn't been doing drugs started doing drugs. Then people had to be separated from their loved ones, like the elderly. So the advice that they stay away from their loved ones. And the people who were already ill had to stay away from their loved ones. And this was devastating for many people. So what has been learned from the pandemic? What has been learned from the emotional, physical, and mental effects of this pandemic? So from what we have learned is how to cope. That's what we've learned, how not to be overwhelmed or to succumb to this situation. And people have learned the following. One, to determine to what degree you and your family are actually at risk. People have learned to do a risk assessment. Look at things. You find many people that seem not to be worried about it. They took a decision from way early not to be affected, not to get the right information, to act appropriately. Then look to reliable sources to get your news. We've learned that. if you get information from the wrong sources, then that means you have the wrong information there. That means you're going to act in the wrong way. So people have learned to seek the right kind of information. To adhere to recommended guidelines. Those who kept to the guidelines, who stayed home, who washed their hands and largely kept themselves safe. Then not to affect to prevent the emotional and mental torture of this kind of situation, pace your news watching. Be sure not to keep on some people are monitoring the statistics by per second. Oh, so and so number of cases today, so and so number of deaths tomorrow. It's important not to do that, but to keep the focus on staying alive and staying well. Then important thing that people learned was to connect to each other, even while they were social distanced. So things like FaceTime, Skype, Zoom, WhatsApp, they all became very important and very useful skills. So many people that were using them. Some people say, "Oh, I don't do WhatsApp." I've heard people say that before. I don't do social media. They had to get on the platform because it became important if we were going to survive the pandemic. So people have learned to find reasons to be joyful. Yeah, there's a pandemic going on, but while you are indoors doing your working through your laptop and your phone, still be joyful. So continuing these lessons, people have learned to join or stay active in one online community. I, for one, have become a part. Now I have so many groups I belong to that came up during the pandemic. Some for different reasons. Some because we were doing something to help with the pandemic. Another professional one, we're trying to come up with our own solutions. Doing our own research, trying to put our own information out there for the pandemic, and things like that. So then people have learned to express how they feel, to talk, to connect, to let people, they share their feelings about it, because the suicide rate went up during this pandemic. It caused a lot of people to feel alone, to feel devastated. And then sharing, talking to people, that's when you find out that your situation is not the worst. And then people can learn about how other people went through this, how they thrived through it, and see what they can pick up. So the pandemic has taught us that lesson, that we need each other. We're not alone. And then to keep a positive attitude and have a sense of hope for the future, extremely important. Because look at it, a few months down the line, we have a vaccine. If we had given up hope at the very beginning, we wouldn't be here where we are right now. Then take care of yourself. Practice relaxation techniques. Find ways to grow your strength inside. So that's what people have learned, to become stronger inside. Even the children, at least the children I have, they're stronger people inside. They're not, it's going to take a lot more to get them perplexed, because they saw the whole thing. Sometimes we think it was only us adults that went through it, but they saw the whole thing, and they came out strong. So it's important that people have learned to look inwards, and look to inner strength, and then pray often, have faith in God. Once we lose our faith, that's number one, the number one time to be lost, because that's practically the only hope that we have. Then participating in activities you enjoy. During the time of the lockdown, all the long periods of staying home and then still isolating as much as possible, I saw people that, the people around me, the skills they had to come out. I didn't know somebody here did hair, but within that time, she started a salon and started doing hair. Then some people baked, they started a bakery, they still keeping up with it. So the activities we enjoy, those things that are, inherent to us, we should learn to look inwards and learn to, propagate those things that we enjoy. And from there, we can actually improve our livelihood. Then new projects. The pandemic has taught us to, anything that was in your heart to do, it came to you as something that is relevant for today. So people have, pushed up their projects. People have started businesses online. People have revamped old businesses that they thought they would do. Then some people have taken up their skill, their artwork. As part of I made contact with an artist who put something together for the pandemic, and that artwork actually has become the theme of my work. And so people like that, they dug back into those things that they always wanted to be, and they've propagated it. Then we need to learn to find ways to laugh, cheer up. You know, life was getting a little bit too serious. If you believe me, if you agree with me, we've learned to to look and laugh at the simple things. Then exercise at a comfortable level. It's important. It's a key factor in staying healthy at all times. But before you exercise, try to get some advice from your doctor so that you're doing prescribed exercises rather than anything that's going to be harmful to you. And people should have learned to take breaks, mental breaks. I see the way people enjoy things now, the way they enjoy family, the way they enjoy their children. It's a little different now. Then it's important to keep physically healthy. People have learned to eat right, prioritize on their sleep, drink plenty of water, limit alcohol and caffeine. People have learned to stop smoking, since we now know that diseases like that do not do well with smokers. Then illegal drugs, people are putting those away. Then people that are on medication are learning to take their medication as well, because they've learned that there's importance in long-term health. Then people have learned to have regular, contact with their doctor. You can do that now via phone call. There's something now called telemedicine. You don't have to go to the doctor's office to get a full consultation from your doctor. So face-to-face, you can have it remotely using tools like Zoom. You can use Skype, even to see your doctor. You can show your doctor your lesion from remotely using using one of these tools. But there are 3 core lessons that we should take away, along with all the others. Number 1, prioritize your health. Prioritize your health. That is a key factor, that we should place our health as priority. Stay informed, correct, appropriate, right, adequate, complete, wholesome kind of information, not the wrong kind or the kind that will get you uncomfortable. Then embrace change. The world has changed, if anybody will agree with me. With the way we are doing things now, it's so different. Children have not left their houses for upwards. Some people have transited from one class to the next. Now they're going to the next and they have not seen the 4 walls of school. It's amazing. Embrace change if you're going to win. So stay connected. That's one major lesson. If you stay connected, you get information. If you stay connected, you know what others know. You know where they're going to. You know how they're managing to feed, how they're managing to prosper. So stay connected via forum. If a forum like a Zoom meeting or a women's meeting, when those invitations come, embrace them, take them, and learn what you need to learn. Stay connected. Then in conclusion, so this pandemic came, it affected people's lives. The whole thing was complicated, it was life-changing, and it was widespread. No country was spared, no part of the world. There was nobody that was in a hole somewhere that wasn't affected. It affected everybody. But we have to say that for those who know someone who faced this disease, who experienced it, who suffered it, who had it, who caught the infection, or worse, those who know people who had succumbed to it, that means they died. Those who lost loved ones. I know how many of my precious colleagues I lost. It's important for us to know and to let them know that the world feels it with them, because it was devastating. For me, among my colleagues, it took the best of the best, the nicest people, the most successful, it took the kindest hearts, the people that reach out the most. That's who COVID took. It was devastating in a very peculiar way. And so the message is that people should know that the thoughts are of everybody's with them. People are thinking about them. People are concerned about them. People feel what they feel. And so it's a remarkable time in our future. And so let's take it as that's what it is, which is an event that happened, but let's move beyond it. For the majority who are able to avoid contracting this illness or who have thankfully recovered, it's not over. The challenges are still there. We still need to protect ourselves. We still need to win in life. So we hope that people can actually learn from the lessons that have come out from the pandemic and move forward in a most amazing way. And I hope that with this talk, I'll be able to help anyone who is having trouble with the pandemic or who has questions, and most of all, help you to be able to transmit the message to other people. And I hope that we will return to our normal in the near future. Very soon we'll hear that the pandemic is all settled, we are all fine, and we're going about life normally. And that we'll leave the pandemic behind us, learn our lessons, and come out strong. So the important thing here is ask for help. Let's take that message to people. When you're going through these things, ask for help. And for us and for anybody who can, give help. That's what's one thing we've taken away from this pandemic. So I want to talk about my book. After being a doctor and being in a place like Nigeria where a lot of questions come out about things like the pandemic, it was important for me because I didn't get any rest. There were times that there were questions coming from everywhere. You would give the same person the same answer or different answers at different times about the same question. So people were worried. People were in a frenzy. People wanted answers. People wanted to be free of it. And so it was a very busy time for me, very emotionally draining for me. And so I had to do something to put it all together. And so all that burden, all my own personal struggle and the struggle that was around me, I put it together and put it together in a book. And the whole idea is a book that will touch the heart of people, a book that will give people direction, a book that will take us even beyond, even in matters not relating to the pandemic, that will enrich us so that we'll be healthy. So the content of the book is all about pandemics. There's a part about pandemics. There's a part about the experiences of people. Then the effects of the pandemic. Then getting perspective when it comes to this pandemic, putting it in a particular, putting it where it belongs. Something that we should just put aside and move on. And then chatting a way forward. So I got a few book reviews. This is a very close friend of mine who quickly read the book, immediately came out and gave me a beautiful review. And this is just one out of at least 120 reviews I've received so far. So who's the book for? It's for travelers, it's for people that are health conscious, people that healthcare professionals, people that work in healthcare so that they know what to tell people. It's for teachers, it's for educators, and it's for students. Then the book is also for both male and female, it's for everybody. And it's something that young people will find very useful because it's addressed some of their challenges, especially challenges like suicide and having their lives disrupted. Then where can this book find its relevance? We can find it in pharmacy shops, you can find it in gyms, you can find it in vaccine stations, you can find it. So look for the book anywhere else, or you can order yours straight up from here. But advise that if you have PTA meetings, if you have health outreaches that you want to organize, if you want to have anywhere that that people gather and they should know about health, that is an excellent place for this book. And then people that are interested in this book are, people that they want to go out, they want to be free to go and do what they want to do. So they want to go shopping, or people that are intellectuals, they want to be well informed, they want to be able to go out and live their lives free with the right information. And then parents, and then people in groups have found the book useful as well. So what are the benefits to the person who reads the book? The benefits of the book to you who reads the book is supposed to help us navigate the spiritual, emotional, mental, and social effects of the pandemic. Then the socio-economic aspect, because a lot of devastation has gone on in our economy. How to even look to how to help our health, even when it comes to the fact that economically we've been disadvantaged by the situation. And then it's definitely useful for our health beyond the pandemic as a general tool to help us to stay healthy. So thank you very much for this time and for the opportunity to speak with you. Here are my details. I can be reached on Instagram at Dr. Oluchi Kanma-Okafor, on Twitter at Kanma Oluchi. This is my LinkedIn detail. And then my phone number is 08080885588. Thanks for your attention. I really appreciate it. And I'm open to questions and answers. Thank you very much.
Wow. That was so amazing. Please, let us appreciate our guests. My goodness, that was awesome. If you can stop your Dr. Oluchi, let's put you on the big. You're fantastic. Thank you so much. Please, let's appreciate Doctor for that fantastic presentation. Please, you can type in your appreciation. That was so beautiful. I love the fact that you touched different aspects. People might have been thinking about the things that you said, but now that you put it into perspective, it's easier for people to deal with it, because you can only deal with things that you already conceptualized, that is already, is tangible to you. You understand, mentally. Like the things that you spoke about, like the emotions, the challenges that people had, even financially. You talked about people having challenges, and you're asking people to speak up. Sometimes we even need to ask people to speak up. As in, if you don't go asking people, they might not even open up. So I thank you so much for your time. This was so informative, well put together, very articulate, just a perfect presentation of the tools that you even have in your book. So I'm really excited that I think you should still put up the page that talks about your contacts. It's very important that you put that up as well, in case somebody needs to get the book, so that is there while we take questions. So thank you all so much for being here. If you have questions, I'm seeing questions already. Okay, please. Thank you so much, Dr. Oludare Yetunde, for being here. Okay, we are so honored to have you. We thank you so much to all our guests. The information is on the screen. If you want to have Dr. Oluchi Kanma-Okafor's number, you want her to talk to a group, give a health talk, or you want to have this book, I promise you need to have this. It's like your armor for this season and for future. Like if you have kids going on boarding school and stuff, I like that it's also a very easy read. You can go over it again and again. Please type your questions on the chat. Let us take your questions. So we have a question from Mr. Gabriel Opeki. So his question is, a big thank you, doctor, for the presentation. My question is, so far, the present vaccination is not a cure for COVID-19. Why then must I get it myself? Very good question. So he's saying that if the vaccine is not a cure, why should I take it? Why should anyone take the vaccine if it's not going to cure or prevent people from getting the COVID-19 infection? Go ahead, Doctor.
Okay. Well, thank you for your question. That's a very good one, because I know that that's in the mind of a lot of people. First of all, vaccines are not cures. if you take your mind back to children around us, when they are born, before they leave the hospital, we give them BCG. When they don't have any infection before we give them, they're born clean from everything about them is fine, but we just give them BCG. So vaccines are not to cure anything. Vaccines are always to help us build our immunity so that if we get in contact with that infection or that infective agent, we will either have built enough immunity in ourselves to fight it, or should it even make its way into our bodies, we already have some, the body's apparatus for fighting available. So we will not suffer so much. Our bodies will not succumb so much to it. So vaccines have never been to cure anything. Thank you.
Thank you so much. So your advice is that he should get the vaccine, right? So everyone, yes, absolutely. So everyone it's very important, please, for us to, take our vaccine. I've had my shot, doctor has had her shot. It's very simple. You get it. It's better to be safe than sorry. And the vaccines are not there to prevent infection. Most of these vaccines are given to prevent hospitalization, severe phase of the infection and death. So you want to make sure, even if you get it, it's just going to be like a common flu. It's not something that is going to get you completely down or probably die. Okay, because people that have BCG still have some infection, probably will get infected with tuberculosis, but not express it because they are vaccinated. That's exactly where we want this to get to. So please, let us all, I will seriously encourage every single one of you to take your vaccine, take it. Because the more we are all, there's something called herd immunity, the more we are all immunized and we now have a better immunity, it's going to help all of us to beat this. So we cannot beat this on our own. We have to do it together. So the more people that take this vaccine, the better it is for every single one of us. Thank you so much, Dr. Oluchi Kanma-Okafor, for that response. So another question from Honorable Omolara Gazalu. She's saying, what are the likely side effects of the vaccine? What are the likely side effects of the vaccine?
Okay, thanks for that question as well, because I know that's in the mind of everyone as well. So like with every other vaccine, you know what a vaccine is made up of? Well, it's made up of some aspects of the infective agent made inactive so that we don't get infection from it. And then it is, prepared in that version so that when it gets into the body starts to build up a defense against it. So what it comes into the body is as an antigen, but the body now provides, we have the means in our body to provide antibodies. So what we now have is antibodies to that in our body, so that the day we get exposed to the virus, we already have the antibodies, so we can fight it. Now, the side effects will be similar to those of every other vaccine. So if you cast your mind back, or if you know children, when you give them a vaccine, remember, the baby comes home that day, the baby's crying, you have to give the baby some, warm, cold water, cold compress, give the baby antipyretic, something to help reduce the fever, make them more comfortable. You give them food, you have to pat them to sleep and all that. So for about a day, or it depends on the baby, maybe a day, 2 days, they're unhappy, they're crying, the vaccine site is painful, it might swell, then you put ice blocks on it. Then, the same things that happen with other vaccines are the same things that will happen with this vaccine. So some people have taken those other vaccines that we're used to, and they've had unusual side effects. So those will be, unusual. But the usual side effects are, like feeling unwell, have a slight temperature. Maybe one or two people said they've had a headache. One or two people said they've had, they just feel tired. They feel that they need to go lie down and things like that. So those are the usual side effects. And I think those are the side effects of every other vaccine. Thank you.
Fantastic. Thank you so much for that response. Just putting information on the chat section where you can join the Leading Women community. Even if you're a guy, it's fine. Even if you're a guy, it's fine. You can join so that you can see the recording. All these recordings will be there in this community. It's going to be a Facebook community. So we'll have a lot of our recordings there, and even some of the videos that I've seen from reliable source that answers most of the concerns that you have about the pandemic, and lots more will be placed on that community. So if you'd like to be a part of that, you can send your name, location, and LWS so that you will know that you were here on the Leading Women series, okay? And then we can send you information about the recording and the link to the community. So we have another question here concerning a particular brand of a vaccine. I don't know the person that is asking this because the name is not, your name is not tagged. It's Galaxy A21, I think. So the person is asking, what about the side effect of Astra? Not sure the spelling, Astra vaccine. So I don't know if you are familiar with that brand, if you have anything to share for, as regards that question. Go ahead, Dr. Oluchi.
Okay, yes, and thank you for that question. And that is exactly the vaccine that is available in Nigeria. And so that has affected seriously the uptake of the vaccine. We're having a lot of vaccine hesitancy because of that. But a few parts of the world, they've reported that the Astra vaccine will probably lead to some kind of blood clots or to some other effects. I've read all sorts of outcomes, and those are being investigated so far. But like I said before, there's some unusual side effects that may come from a vaccine, depending on the particular person's constitution. And so that's why when you take the vaccine, they give you some time, you'll sit down, they monitor you, they take your details. So the important thing is, should a person develop any of the side effects, they should report back and they'll get the help they need. But as we sometimes say in medicine, the benefits outweigh the risks.
Absolutely.
So yeah, so for someone like me, a health worker, I'm not sure I have a choice, really. So if I'm going to keep up with the work that I know, it's a little bit too late for me to learn a new trade. So I've taken my vaccine, even though I know about the side effects. So that's it. That's my response to that.
Absolutely. When I took mine, I had I was a bit feverish, I was a bit down, but that also happened to me when I took my flu shot when I had my son, So it's the same thing. Your immunity is building itself to fight against to build the soldiers that is needed in case we are really, really exposed to this virus. So it's better for us to receive them. There was a study, there's a video, which is also going to be on our community page, that shows comparisons of all these vaccines and the outcome. Or every single one of these vaccines would protect you from having a severe infection of COVID-19, being hospitalized or dying, okay? Every single one. So to answer your question, the best vaccine for you to take is the one you are offered. That's just the simple truth. The best vaccine for you to take against COVID-19 is the one you are offered, all right? So we have another question. So many people want to really engage with you. We are working with time, so we'll just take maybe 2 more and then we'll wrap up if it's okay with the house. And we'll take a vote of thanks from Honorable Ghazalo. So we have a question from Noblin Obona. Okay, Noblin, she's a fantastic lady, part of the coordinators of the Sustainable Development Goals as SDG 3 Global. They do a lot of big work, okay, with giving information and awareness. These are the kind of ladies we are talking about in this community that are making change, as an impactful change in our world today. Thank you so much, Oguna, for being here with us. Her question is, a lot of folks aren't interested in getting the vaccine because they have this perception that it is rushed in manufacturing. What do you have to say to them, Dr. Oluchi?
Well, I would say that it seems like we rushed, yes, but it required that kind of serious attention. If you ask me, in Nigeria, we have a big problem, which is malaria. But so far, we have not developed a vaccine. And I believe that is because the problem has not been considered or categorized as that important. That's why we have not rushed to create a vaccine as well.
Exactly.
But the situation, I think, warrants that really serious efforts to bring this vaccine out from day one. Because maybe with knowledge, over the years, we have enough knowledge now to know that when it comes to viral infection, because whether or not we want to agree, outside of this country, they suffer from this kind of situations pretty often. They remember they have MERS and SARS. All these are always ongoing outside this country, in some countries in Europe. MERS is actually ongoing as well right now, but we don't experience them here. So we have the feeling where we just feel like, oh, this is a one-off. But they have these things, bird flu, swine flu, and then they've seen the importance of the vaccine, that it comes to change a lot of things. So that's why the world moved towards a vaccine quickly. And there's some characteristics that tell you of a disease that would benefit from the control of which will benefit from a vaccine. And so because of the nature of this particular disease, a vaccine was necessitated. Now, the steps towards providing a vaccine, none of it was skipped. Nothing was jumped, nothing was skipped, nothing was disregarded. It just means that it was given the opportunity to move on from stage to stage really quickly. So, and maybe even with the other vaccines, are we completely done with collecting data on them? No. If you go to the next health center near you, and they're giving children measles vaccine, giving them polio vaccine and all that, there's somebody by the side. You see their stand. It's called AEFI. It's written on it, and in fact, there's somebody who's designated to stand there and watch. So that means adverse effects following immunization. Those are still being studied. I took polio as a child. I saw my birth certificate. I took BCG as a child. How many years later, we're still studying it? So it's important to study these things, and it's important because of need, to use the vaccine at this time. So everything has been done appropriately. So that's why I think it's safe. Thank you.
Thank you so much. Thank you so much for, thank you all so much for, joining in for your questions. I see every single, yes, exactly. Malaria vaccine is not rushed yet because malaria affects only Africa. Well, to be honest though, you understand this whole experience that we're having, COVID-19 was quite dire, was very aggressive. So I'm sure there was a lot of resources pumped into it, human resources as well. So you can imagine if you want to do any project, probably you want to arrange 1,000 chairs, okay, for an event, okay, for lack of a better illustration. If one person were to arrange those number of chairs, it would probably take the person the whole day. But if 1,000 people should come in and arrange those chairs, it would take one day. It would take like a minute, okay? So that is exactly what happened. Let us not be comparing how long with how effective it is. It's because it was a dire situation, all hands on deck, and then something had to be done, okay? People were dying. I'm sure we all know someone, that have, passed on because of this pandemic. So we cannot go out there, educate yourself. You can educate your loved ones. You can educate your community. You can do that in a safe way with the right information. And that's why we are here, to give you this information today. And if you can get your own copy of the book even better, or share it with someone, okay? So I want to appreciate every single one on this call. We have so many people. Behind COVID was a vaccine, which had long before. Absolutely. I see all your concerns. I appreciate it. I am absolutely loving it. I want to appreciate everyone on this call. We have, like I said, we have Honorable Omolara here, Gazalo. If you can put on your video, please, so that you can give the vote of thanks as we wrap up, that would be great. We have Madam Aderonke Akande. Thank you so much for being here. Amaka NM, God bless you. We appreciate you. Dr. Chinwe, I think Igwe, thank you so much for joining us. We have Christy Gando. Thank you so much for being here. I think Galaxy 281 is Madam Ajibike. I think she typed her name in the chat box. Thank you so much for that brilliant question and for your contribution. We have Galaxy Note 10. I don't know who that is. Please, anytime you come in, just type in your name and where you're listening from. We always want to acknowledge you properly. We also have Gloria Umu Kotete from Delta State. I've destroyed your name. Please forgive me. We have Ireju A here as well. Thank you so much. Noblin Ogona, I think you're in the United States. I can't remember the state now. Thank you so much for joining in. My baby girl, Dr. Oge, thank you so much for being here. Mr. Gabriel Okweki, thank you so much. Oge is also in the United States. Madam Okwe, I see you. Pharmacist Olua Tosin Odumabo, thank you so much for being here. Tayo Unique Way. We also have Dr. Yetunde Oludare, thank you so much. Okay, Dr. Ireju is from Port Harcourt. Thank you so much for being here. These are powerful ladies from Medical Women Association of Nigeria, which I'm also a part of. Oh, thank you so much for inviting her, Doc. We are so appreciative. So if we can put the slides down, I'd like to welcome Honorable Gazato for the vote of thanks as we end the presentation. Honorable, are you there? Are you there? You can unmute your mic. These are powerful ladies, okay, when it comes to Sweeney, people that took up the road of leadership in our community, okay? She's also part of the organizers and the person that came up with the idea and said, let's do this. And I said, absolutely, it is something that is, that needed to be done. And I'm so glad that you've all gotten value from this talk. Dr. Oluchi, can you stop the share? Let me put up. Okay, awesome. Thank you so much. Honorable, are you there? Okay, yes, we can see you. Go ahead, please. Vote of thanks to our guest speaker today.
Thank you very much. Thank you very much, Dr. Oluchi Kanma-Okafor. I really appreciate you.
Thank you. Thank you.
We hope you're able to come next time.
Pardon?
You dug deep into the lecture and you touched every aspect of it.
Okay.
Mm-hmm.
So we're saying a big thank you to you. Thank you very much, ma'am. Yeah, remain blessed.
Thank you so much. Thanks for having me.
Our pleasure. Our pleasure.
Thank you so much. All right. Thank you so much, everyone. Thank you, Honorable Gazaro. We will be doing this very, very periodically. So if there's any topic that you'd like to discuss, I would love to hear it, and then we'll organize and get the specialists to come in. My number is there. You're just sending your name, your location, and the letters LWS, so that I'll know that it was from this platform that you heard about, that you contacted me, okay? And then we can add you to the community that we are slowly building on Facebook. So all our recordings are going to be there. If you have questions, you can put them there. And of course, we'll be giving more information that would enlighten you to become, to add more value in your community, add more value with your family, okay? Thank you so much for joining us today. We really appreciate you guys. We want you to have a wonderful Sunday evening, and we'll see you soon. We'll see you when we see you, basically. Thank you so much, everyone. Oh, let me unmute you. You're trying to say something honorable. You have to unmute your mic, and you can put on your video if you like, so that we'll see your faces. We love seeing people's faces. So thank you all for joining. God bless you.